Hello and welcome to the Journal of Marital and Family Therapy's Decade in Review video series, hosted by the American Association for Marriage and Family Therapy. The special Decade in Review issue is the fourth of its kind over the years and assesses the efficacy and effectiveness of couple and family therapy by reviewing rigorous studies published over the 10-year period from 2010 to 2019. The findings from the special issue show tremendous progress and achievements made to date, inspiring our continued commitment to making marriage and family therapy and interventions widely available. Throughout the series, we'll talk directly with the authors who made this special issue a reality. Today's focus is on depression and bipolar disorders. I'm joined today by our lead author, Andrea Wittenborn, and co-authors Sarah Woods and Jacob Priest. First, just let me say thank you all for being here today. And Andrea, if it's okay with you, I'd like to start with you to set the stage. Can you talk to us a little bit about how depression and bipolar disorders impact the entire family?
Yes, hi Glenn, thanks for having us. Depression and bipolar are quite common. In fact, depression is the most common cause of disability in the world. And we know, from our personal experiences that when one person in our family is suffering, we're all affected. And actually, there's a term for this. We call it we disease. It was introduced to reflect the coping and experiencing that couples and families encounter together. So it's not uncommon for families to be impacted by depression and bipolar. And they're affected in a number of ways. A family member's depression may manifest through irritability and anger that can be directed towards other members of their family, leading to increased family conflict. On the other hand, depression may manifest through sad mood and a strong need for reassurance, which can tax a family member's resources and cause the person who is suffering to feel like almost a burden to their family. When it comes to bipolar, a manic episode can cause people to make reckless or poor choices. It can lead to damage to a family's finances, their property, their relationships. So just like with any condition, whether it's cancer, heart disease, or in this case, depression, family members are faced with the challenge of identifying the condition, seeking the professional help that they need, and learning strategies to cope together. That process can be overwhelming, especially with respect to conditions that can be so disabling and are also actually linked to suicide. So that can be pretty scary for families. But the good news here is that couple and family interventions are powerful tools for testing, for treating depression and bipolar, because they simultaneously treat the condition and improve the family environment, in part by harnessing the healing capacity of relationships.
Thanks very much. Sarah, can you tell us about the relationship between those that suffer from these disorders and their families, both the positive and negative aspects, and speak to a little bit about how can marital or family therapy help?
Yeah, so I think quite similar to how Andrea just described these connections between depressive and bipolar disorders and family relationships. I think it's important to think about that in both directions and also from positive and negative angles, meaning that families that experience a lot of stress in their relationships or outside of their relationships, outside of their family, in their environment, that chronic stress and sometimes perpetual conflict over time can really affect people's mood. And I also think it's not necessarily always just about stress, but also really important that family relationships that are characterized by insufficient support and insufficient connection can also affect our mood. But for people with depression or bipolar disorder, what's also important to consider is that the quality of our family relationships impact not only our ability to achieve remission, to achieve symptom relief in these conditions, but also if they're negative, if our family relationships are are angry or distant or challenged from all kinds of external stressors too, it also can affect our ability to stay in remission. So for people who have depression and bipolar disorder, if they have been doing well for a while, relationships that are negative with the people that we're closest to can also predict our likelihood to relapse and experience those symptoms again and feel worse, which is what we're hoping to avoid when we're treating depression and bipolar disorder. We're hoping to create change and positive movement towards feeling better, and then to maintain that improvement over time. And so, as Andrea said too, I think also the experience of living with depression or bipolar disorder affects our family relationships. So our family members have a desire to help, and when they feel sometimes like they can't help and they start to feel helpless, that can really be very fraying. It can affect our connections with one another. And also, I think in the current context of mental health care, when it can be especially difficult to access care, or sometimes challenging to access sufficient care for what our family member is going through, that can also really affect create lots of stress in our family. So the depression and bipolar disorder, as Andrea shared, can also be really very disabling. And so it affects our family members' ability to work. It affects our family members' ability to parent and engage in all of these different roles, not just in the relationship and connection that we have together, but all of these different roles that make up how our family operates. And when that's impacted and other family members are working really hard to cover, to pick up slack, to offer support, while some of these other pieces are falling apart, that can be stressful for absolutely everybody. So I think it is also, on the flip side, important to remember that, and part of what's so important about this research, this research that I think we've summarized, that Andrea's led our summary of, is that it's so valuable when we interact with families in family-based and couple-based care and increase family support. So when we improve family relationship quality, and when family relationships are positive and they feel supportive, it can, the flip side is, it can help to improve mood. It can help to also improve and maintain engagement in care. A lot of times, by function of these mental health conditions, by function of depression and bipolar disorder, there are lots of times where people with these experiences may not want to continue in treatment. And that's part of the sort of really reciprocal challenge of treating these mental health conditions, is when people don't want to engage in care, but supportive family members can help to support people living with these conditions to stay engaged in care. And when they themselves are also part of that care, it can grow hope across the family, and promote learning about what exactly it means to live with these conditions and what this treatment process is going to look like.
Thanks so much, Sarah. And that's a sort of a great lead-in for my next question for Jacob. In the article, you say that among those who experience depression or bipolar disorder, too few get the treatment that they need. Can you walk us through what are some of the reasons for that?
Well, as Sarah mentioned, access is a big one. Depending on where you live, I live in Iowa, and there are some counties that maybe have one or two mental health providers. So just access to care, whether that be providers or insurance. There's some people who would have insurance plans that are not going to be able to get access to care they need, or who don't have insurance. And so mental health care, paying out of pocket, can be really, really expensive. Another reason too is there's still a lot of stigma associated with depression and bipolar. So people often, when you're feeling depressed, it's like, well, just go outside and go for a run, or, start eating healthy, or just buy a puppy. It's this idea that it isn't really a disease or something that provides disability. It's a fault of character or mental toughness, which I think that stigma is really problematic and harmful, because when we take that approach, it's likely that we are just going to place a greater burden on the individual and on the family, which can then worsen these symptoms. So between access, stigma, and a myriad of other factors, including, what types of treatments are available, what types of treatments insurance will cover, can really have a big effect on who can get access to care.
Thank you. So Andrea, when you were putting this article together, you and your team, what evidence did you find to support couple and family therapy approaches?
Yeah, well, I think that the story here is, there's a lot of good news for people who are suffering. So, even before we started this article and started this review, we know that there have been decades of research that show consistently that family-based interventions improve depression and bipolar. So that's the good news. For this article in particular, we carefully reviewed the past decade of research on couple and family interventions for both depression and bipolar. We then combined that with the cumulative literature and then carefully assessed it according to standards in the field for empirically supported interventions to then provide practice recommendations. So therapists can actually turn to the final pages of our article to see a very clear report of our evaluation of the current evidence base. And our evaluation is rank ordered from couple and family interventions that are well established to those that are considered experimental. And so this information will provide the most up-to-date practice guidelines on couple and family interventions for depression and bipolar. In our review, specifically, we identified several well-established interventions. Those include interventions that are in the family of a couple and behavioral couple and family interventions for depression, and then psychoeducational interventions, which are often combined with medication management for bipolar disorders. Probably efficacious interventions for depression include attachment-based couple and family interventions.
So Sarah, can you tell us a little bit about what did the evidence tell you about what works for people dealing with depression?
Yeah, so as Andrea just described, in describing and classifying the level of research evidence we have in support of these different couple and family-based interventions, we found lots of really great support for multiple different kinds of approaches, which we also tried to categorize in terms of the theoretical approach, the treatment categories, groups of treatments that are not necessarily specifically the same, but oriented towards approaching treatment in the same ways. So for family-based interventions for depression, we found strong evidence for family-based cognitive or behavioral approaches that, as Andrea just shared, are considered well-established, which means that they, in the different research studies that we reviewed, they functioned better than or the same as equivalent to another intervention in at least 2 randomized controlled trials, meaning they're comparing that specific treatment to another treatment or wait list control. And also these treatments are manualized, meaning for people who also may be interested in learning them, the authors of these approaches create specifics about what these interventions look like, which I think is also really helpful for people wanting to learn and approach treating depression and bipolar disorders in the most effective ways that we currently know how. So for cognitive behavioral approaches, specifically, an example that we found that was part of our well-established collection of approaches was family-focused treatment for childhood depression. And for attachment-based approaches, especially for adolescents, we found that attachment-based family therapy was probably efficacious as one example of each of those kinds of approaches. And then in terms of couple-based approaches for depression, we found evidence for, again, that cognitive behavioral couple-based approach. And an example of that was brief problem-focused cognitive therapy. And then again, in that attachment-based approach category, we found emotionally focused couples therapy was probably efficacious, meaning that those kinds of tests have typically one clinical trial in which they're superior or equivalent to an established intervention, which means that we have multiple different options for approaching care for young people, for young children, for adolescents, and also for adults across the lifespan that we can target through either family-based approaches or couple-based care.
Jacob, a similar question. What did the evidence tell you about what works for those with bipolar disorder?
Yeah, so we really focus, well, I think most of our studies focused on family therapy for youth with bipolar disorder. And what we found was typically they were using psychoeducational approaches, which is when the person with bipolar disorder is given medication, and then the family is provided with communication, problem-solving skills, and information about the disorder itself. And we found that these types of treatments work typically better or the same as those comparison types of treatments, and in all cases work better than those waitlist controls. So really, we do see the evidence when it comes to family therapy interventions for bipolar disorder, especially with youth, adolescents, that we have some strong evidence that these interventions are working and working well.
Sarah, can you talk about the discoveries that you made between family therapy for depression and couple therapy for depression?
Sure. So I think across the board, what's really exciting is that we found evidence of how valuable it is to target both the symptoms that people are experiencing of depression or bipolar disorder, but also the mental health condition in the context of relationships. That harnessing the power of relationships in treating depression is incredibly valuable. So in those studies of family-based treatment for depression, there were several that compared the family-based intervention to individual psychotherapy as an example. And of those 4 studies that we had reviewed, 3 of those found that the family intervention was significantly better at reducing depression. And in the final study, they were equivalent, meaning in the context of family-based care for young people, it is very valuable and may quite possibly achieve better symptom relief for young people experiencing depression when we involve their family members. I think what's also really interesting in thinking about, you had asked about both family therapy and couple-based interventions, but in the family-based interventions, we also found variations in how family members are involved in the intervention, meaning we found approaches that ranged from involving parents, sometimes siblings, for support or psychoeducation, as Jacob described, or communication skills training as examples, all the way to interventions that really focused on the family process and addressing problematic family patterns that serve to persist the young person's experience of depression. So there are a range of ways that we can intervene with families and family relationships in terms of supporting people who are experiencing depression. I also think that notable is that we found obviously couple-based approaches for adults, but family-based approaches were typically targeted towards kids and adolescents. Whereas we know that there are lots of people who are not currently partnered. And so thinking about one area for eventual additional study is some of these, especially psychoeducational approaches for depression that might be also helpful for adults with depressive disorders and helping their family members to understand what they're experiencing.
Thanks so much, Sarah. Jacob, were any of those findings surprising to you at all?
Well, I think surprising is an interesting word, but I think first of all, as Andrea mentioned in the beginning, we do have a lot of evidence, and I think that's a good surprise. We do have a lot of evidence that couple and family-based treatments work in treating depression and bipolar. I think the flip side of that, though, is also, which is potentially surprising, is that we have a ways to go. While these tend to work pretty well, I think that there's places where we can really develop and enhance these couple and family therapy treatments to provide better care to families, to couples who struggle. And as Sarah mentioned too, we're thinking specifically about most adults. When we think about adults, we're thinking about couples, but there's a lot of adults out there who aren't partnered, who their families play a big role in helping them manage or deal with their depression and bipolar symptoms. So it's important to conduct research in that realm. I think that what's surprising, or maybe a better word is exciting for me, is that we do have this base of knowledge that the next generation of researchers can build off of to provide better care, to be more innovative in the world of couple and family therapy. And really, I think sometimes a lot of these, as was mentioned before, vary in the level that they involve the partner or the family member in treatment. And I think it would be great to see in the future this ability to bring about more of this idea of a systemic approach to these treatments, where the family is seen as a system that helps generate and potentially maintain some of these symptoms, and what we can do of treating the whole symptom to improve outcomes and help those who suffer.
Thank you, Jacob. Andrea, I'd like to bring it back to you, talking about those with bipolar disorder. What discoveries did you make regarding family and couple therapy?
It's really interesting when it comes to bipolar. We've heard some now about, the research base for depression with couple and family interventions. When it comes to bipolar, we have actually a clearer picture of which family interventions to use. So there's a stronger evidence base for a broader evidence base for family interventions for bipolar. There were a history of research that has been done in this area. And then in our review, so in the past decade alone, there were 5 recent studies on family interventions for bipolar that added to that cumulative body of research that when we combine all of this data together, the findings clearly indicate that symptoms of bipolar among youth can be reduced through family interventions. We talked about some of those interventions that are useful for people, like family-focused therapy and individual family psychoeducational psychotherapy. These are interventions that are often used in combination with medication management. So we know that we have these, effective interventions available. Now, for the story is a little bit different, and that's not entirely surprising because programs of research are often guided by federal funding priorities. And so we see a lot of funding available to help families. And so we didn't locate actually any qualifying studies for couple interventions for bipolar in the past decade. But the empirical literature on psychoeducational interventions for couples for bipolar does look promising. There have been studies in the past that have looked at interventions for people with their spouses and with other support people, and findings from those studies supported the use of psychoeducational interventions for bipolar, so similar to the types of approaches we would use for families and for youth. So I'm hopeful we'll see more research on couple interventions for bipolar in the coming decade. And in fact, actually, since the publication of this article, I've had people reach out with interest in that area. So hopefully we'll see more research to come.
Great, thanks so much. As a wrap, this will be the last question. I'd like to give each one of you an opportunity to answer for just 30 seconds. What do you think the results of this research mean for therapists? And Andrea, why don't we start with you on that one?
Sure. I guess it's important for therapists to be aware that MFT and the Journal of Marital and Family Therapy make this reliable list of empirically supported interventions available and update it every decade based on new research. The empirical literature is constantly evolving and can be difficult for therapists to discern the best practices for each disorder and condition. And so the goal of our article was really to provide this very useful tool for therapists. And we know that, couple and family interventions for depression and bipolar are effective.
Thanks so much. Sarah, same question. What do you think the results of this research mean for therapists?
I think for marriage and family therapists, it is a nice source of potential confidence that what we do matters and the kind of care we provide isn't just for improving relationships, but it is genuinely and impactfully to improve these really disabling mental health conditions that are so common among all kinds of different areas of our lifespan, that we have the ability to meaningfully intervene and improve things like depression and bipolar disorder using interventions that lots of marriage and family therapists already do. So there are options if you are not exactly sure how to approach these things. That's part of what this paper provides, but also it's quite likely that there are already lots of ways in which the tools we're using and the kind of work that we do, this evidence supports that that's incredibly effective.
Thank you so much. Jacob, over to you. Same question. What do the results of this research mean for therapists?
I think it means for therapists that the future is bright. I think we have a good evidence base to build off of and room to grow. And so I think therapists can take a little bit of confidence away from that, as is mentioned, that, you know, we have evidence for these treatments that you've been trained in and that you know, and knowing that that evidence there, you can take that to the couples and families who are struggling with depression and offer real hope and real help.
All right, I want to say thanks to all of you for taking part in our Decade in Review series and for providing this insightful commentary on the current state of research around couple and family interventions for depressive and bipolar disorders. Your work on this will be invaluable in continuing to advance the profession of marriage and family therapy. I also want to say thank you to all of our viewers for tuning in. We hope you'll reach out in the comments and questions, and you can join in the conversation with us on Twitter by tagging @the AAMFT. That's @the AAMFT. I hope you'll visit the link on the screen to read this article and more from our Decade in Review issue. Thanks so much for tuning in.